Hello everyone, it's Alice at Welldoing, and today I'm talking to Katy Georgiou, who is a psychotherapist in London, and she is also the author of How to Understand and Deal with Stress. So thank you, Katy, for joining us.
Thank you.
And starting with quite a just straightforward idea, is there any such thing as good stress, or is that just a myth?
I think there can be good stress, yeah. Well, the fact is that you can't escape stress in life. At some point you're going to encounter stress. We encounter it all the time, and I think it serves an important function in many ways. Obviously it spurs us on. Without any stress, maybe we wouldn't get things done. It kind of like prompts us up to get motivated and do things. So I think there is some good stress, and it can be a real good motivator. But I think where it starts to tip over on the other side is where it starts to become kind of chronic or problematic, or where your coping mechanisms are difficult for you, and it doesn't feel healthy, and that's when it changes. Yeah.
So what happens in the body when we experience those different stress, like acute versus chronic?
Well, I guess the thing with acute stress is that it's got an end to it. So it's very specific. You can identify the cause, you can identify when it's going to end, and then it changes. So a really obvious example might be something like you've got an exam coming up. You know it's coming up, your heart rate maybe increases, you get adrenaline, especially maybe on the morning of the exam. Maybe you start to get stomach aches, and you need to go to the toilet, or whatever the symptoms are that show up for you. But you have a clear sense of what that's about, and you know very much that this is because you're doing an exam. Maybe you're worried about passing or what the questions are going to be. And then as soon as the exam is done, that dissipates. I mean, you might have other feelings after about how it went, but you know that stress, what it was about, and then it goes. Chronic stress would be very different, where you're in a state of permanent heightened elevated levels of cortisol are elevated within your body, and you're in a high state of adrenaline all the time, hyper aroused, feeling very, very stressed. Sometimes you might know why that is. I mean, it could be because you're in a perpetual situation in your environment that just is enduring. That could be a relationship, it could be a really stressful job, it could be even abuse. And again, you know what that's about. But sometimes it can be that you're sitting with chronic stress and not really even aware of it, and you're not you can't necessarily identify why, but you're in a state of stress, and you might notice that you're always grinding your teeth, or having lots of anxiety, insomnia, or things that you might not immediately connect to stress, but are kind of physical and physiological experiences that you might not be able to pinpoint as stress immediately. But when you drill down on it, you can recognize that you're in a state of chronic stress. Yeah.
And so those are some kind of physical telltale signs. What about like emotional or psychological signals that we're under too much stress?
I think that's with each person it will be really unique. But I think one of the things I would say is that when we talk about mental health in particular, we tend to talk about it in terms of specific issues, like would say anxiety or depression, or going a bit further, you know, whatever your issue is, bipolar, schizophrenia, any of the issues that you're dealing with on a mental health scale. But what we tend to, I've noticed we tend to ignore that stress kind of underpins a lot of those. So they can inform the condition, and they can feed into one another. Very often stress is the trigger for a lot of them. So when you say, like, what are some of the psychological symptoms, actually sometimes symptoms of anxiety, depression, intrusive thoughts are a big one as well. If you suffer with OCD and you have intrusive thoughts, or you're prone to panic attacks, or you are prone to any kind of mental health issue, sometimes those symptoms of that issue can show up in times of great stress, or even be triggered in times of great stress. or exacerbated. Yeah.
Yeah. And I guess a lot of people would have heard of fight or flight, and then some people would have heard of freeze on top of that. But you spoke in your book about flop and fawn, and I think that's less commonly heard about. So maybe you could give us an overview of what that means.
Yeah. So in the book, I talk about stress responses. Some people, you might refer to them as trauma responses as well, but they ultimately show up when you're feeling stress. So we know really, we're very well acquainted with the term flight response, and we typically understand that as our kind of response to threat, and our awareness and understanding that our mind will short circuit to the amygdala in times of threat, so that we end up acting out from a place that's very primitive and instinctive, and we'll often find that we will go back to behaviors that we maybe had when we felt unsafe when we were little, or some of our earliest coping mechanisms, and we tend to speak about that as the fight-flight response. And we know that part really well. Like fight, we're kind of ready for action, and flight, we sort of flee. So some common examples would be that, I don't know, you see a child running out into the road, you run to grab the child. That might be your fight response. Or like you respond to stress by really tackling it head on and facing the trouble or facing the conflict, where flight response would be kind of running off, fleeing, escaping. But even less obviously, it could be something like just kind of giving up on a task or avoiding it rather than confronting it. So not turning up for the exam, for example, might be an example of a flight response, or looking for the exits wherever you are, and wondering where you can get out. But we have freeze, flop and fawn. Freeze, we tend to kind of also talk about fairly often, and that's when it's neither fight or flight, but we just freeze, a bit like a rabbit in headlights. And that will happen, like, I mean, if a car comes towards you, for example, a lot of us will have that response, and it's quite common. And that again can happen in an exam, or if you're giving a speech, suddenly your throat becomes dry, there's nothing will comes out, your mind goes blank. That can be a bit of a freeze response. With flop and fawn, they're quite different. And I think the reason why they're important to mention is because you can identify them and they show up. And sometimes people will ask questions, like, especially on the news, we'll see lots of things happening on the news, like horrible stories of rape and violence and abuse. And you often hear people, especially on social media, saying things like, well, why didn't the person run? Why didn't the person scream? Why didn't the person get help? And I think this is why understanding the flop and fawn response is so important, because this explains what happens to people in moments of great stress or trauma. That the flop response is a kind of dissociation and cutting out completely, or when you're in a state of hyperarousal. So that might mean that you simply faint. It could mean that you just dissociate, you have no memory of what happened. I know people who do faint, or they have epileptic fits in times of great stress. That would be like a flop response, and it's a kind of like a total body collapse. And it can include sort of mind blanks and things like that, or even on a really mild level, like a bit milder on the scale, it could be like becoming dizzy or feeling really tired. That's a really important one to understand, I think. And especially if you've experienced trauma, that might be a more common one, stress response. Fawn, again, is another one where it's lesser known, but it's where you go closer to the source of danger. So it could be that you're in a situation of, or you feel that you're in a situation of great danger, whether you are or not. It feels that way. And actually the ability to fight and the ability to flee is not possible. That could be because you're totally overpowered, disempowered, and actually trying to fight back or flee is going to bring you to more harm or danger, especially if someone's got a weapon on you or they're overpowering you, then it's not possible to escape. I know I'm using quite extreme examples, but just to kind of exemplify the understanding of where a response like that might come from. It can also come from things like if you're being bullied. I think a lot of people might identify with the experience from young of befriending your bullies or befriending someone that's being horrible to you. And again, this is a kind of survival mechanism that it's the best thing you can do to keep safe in that moment. So you kind of stay calm and polite and underplay your anxiety or stress, and befriend and go closer towards the source of stress as your best chance of getting out of there. And there's quite a few examples of that. You've seen that in the news where people talk about sort of getting into cars or walking alongside people and becoming friendship, especially if you're in a very stressful relationship, if there's abuse there, fawning to the person abusing you. And I know I've done it too in situations where I felt quite unsafe, and I've kind of stayed alongside whoever I'm around because I feel quite scared. So that would be a fawn response. And the reason I call it like a stress response is because it does show up in very traumatic incidences, but it can show up in smaller ways with smaller stresses too. And all of these responses show up in their own different ways. And you can see them in the wild as well. And when you look at a wildlife program, you see them happen to animals in the different ways. So yeah, I hope that wasn't too long an explanation. I hope I answered it clearly for you. But those would be did I get through 5? Yeah, 5. Yeah. Those are 5 responses.
It's very interesting. I mean, and would you say people typically get stuck in one pattern of response more than others?
I think it tends to be that if you had a pattern when you were younger, whatever you tended to do then tends to be the thing. It might be your sort of go-to automatic response. But I think a lot of us can identify that we have elements of all of those things. And obviously experiences over our lifetime will teach us different coping strategies and techniques. So I don't think it's that it's fixed for you necessarily, for some more than others depending on what they've been through, but you might have a more prevalent one. I think if I use myself as an example, I think freeze is a really common one for me, but I do identify with all of them in different ways in different scenarios. So I think it's flexible, but you might have a slight propensity for one more than the other.
I mean, it strikes me as something that's really important for people to understand widely, but also about themselves. Because, I mean, as a therapist, do you see people coming who are struggling with the consequences of their own stress response and what that meant for them?
Yeah, I think it's quite a complicated one there because it's so interwoven with what's going on in someone's life and the wider context of their life and their childhood and everything, and it all informs how they are in the room. But absolutely, there's certainly been times, especially now in our current world as we're living in. I mean, our collective stress level is really high. I mean, I would say, we think about, we came out of the pandemic, that we went into, there was the war with Ukraine, we're in a cost of living crisis, the Queen has died. That's just, in the UK as well. But even beyond that, globally, everything that's going on in the world and how people are experiencing it with 24-hour news and social media and the pressures there. I'm definitely noticing and seeing that people are attending therapy in a higher level of stress or baseline stress, and that is coming out quite a lot in panic and anxiety and breathlessness and fear, and those sorts of physiological symptoms that are immediate in the room. I'm definitely noticing a lot more as a therapist in the last couple of years, for sure. Yeah.
I mean, and on that, so what advice could you give people in terms of looking after themselves?
I mention it in the book, but there's quite a lot of different things that are helpful. But I'd say one of the most powerful things is understanding grounding. These are really simple techniques to support you, really. They're supportive ways. And what grounding really means is essentially putting your feet on the ground first and foremost. So when you're in a state of panic or you're not breathing, put your feet on the ground, connect to the floor, and learning breathing techniques. So a really common one is with your feet on the ground, is imagining kind of drawing up the breath through your feet up into your legs and up into your body and your lungs, up to your head on your in breath, and then on your out breath, imagining it coming out of your arms through your fingers back into the air. And repeating this process really slowly and really deeply with your feet really firmly on the ground so that you're secure. You can do that if you're sitting or standing, or even you can even sit cross-legged on the floor doing this, or even lie down on the floor. But the idea is get to the floor as quick as you can and breathe. That's the first step. And then the next would be getting into immediate awareness of your present. And the best and quickest way of doing that is to engage your senses. So when you engage your senses, you come out of your mind straight into your body. And the thing with stress and anxiety is that it is very physically felt, but we often go into our heads with thoughts. So by focusing on your senses, it takes you out of your head into your body and more aware of it. So a common one is just to start with, just as you're breathing, notice what you can smell. Name like a couple of things that you can smell. It might not be much. Then think about anything you can see. Start naming objects in the room. Start with objects. It could be a chair or a light. And then notice colours. Pick out any colours you can see. Then think about what you can hear. Pick out 3 or 4 things you can hear. It could be a plane outside, a bird tweeting. And then notice what you can taste. And then finally touch. So really feel your clothes on your body, see what you can hold. I'm doing it now. I'm holding my book. Just really experience the feel of that. So that's your senses. And also another one that people don't mention, but I mention it in the book, and I think it's a really powerful one, is go to a mirror and look at yourself and look at your reflection. I think there's been studies that have been done. I think they were in Japan, and I might be wrong on that, but I believe so, where studies were done where, to reduce the incidence of suicide on the railways, they installed mirrors on the trains or on the platforms, and that had a really powerful effect to stop people, to confront them with their image just before. Gives you an immediate awareness of your presence, takes you out of your head just for a split second. It's actually a really powerful thing to do, so I recommend just look in a mirror for a moment and look at yourself.
That just gave me goosebumps.
Wow.
Yeah, no, that would be powerful. Interesting. Thank you. Those are really helpful tips. And I mean, obviously there's the next stage where, self-care might feel like it's only getting someone so far. So we might think about counselling or therapy. And I mean, is there any particular types of therapy, or what other advice would you give to someone who isn't sure where to start?
There's so many different types of therapy, and my heart goes out to people, by the way, because I think especially when you're in a state of stress or anxiety or any kind of mental health problem, when you're feeling a bit in crisis and you're desperate for help, And the first thing that happens is, where do I go? Who do I talk to? And the first port of call can often be to tell someone that you know. Of course, sometimes that can be really powerful in and of itself if you've got supportive people around you. But for so many people, either they're on their own and they don't have anyone, or they do, but they're not, those people are not equipped to understand. And then the next step is, okay, what do you do next for, like, if you need something more formal or professional, if you've exhausted routes, like, I would recommend also things like helplines, but if you've exhausted those routes, you've tried everything, you've gone to your GP, told them how you feel, very often the GP will recommend one of two things. They'll either recommend medication, or they'll recommend therapy. And if we're talking about therapy, those things will be offered for the most part on the NHS. So typically, if you're going to your GP, a lot of what's going to be offered on the NHS might be shorter term, there might be waiting lists, and it might be more goal orientated therapies. Usually, not always, but usually they'll be more CBT focused, and all the kinds of therapies around CBT, like commitment and acceptance therapy, narrative therapy. My mind escapes me for a lot of them, but there's a lot that is offered, and a lot of people only know those, but there are also options for longer term psychotherapy and counselling. It's worth mentioning that there are lots of different titles. So you hear things about psychiatrists, psychologists, counsellors, psychotherapists, psychoanalysts, and a lot of people don't know the difference between them. Well, like, who do I go to? So just a quick sort of overview of those things. They're all very distinct job roles. They all do different things. So a psychiatrist is a medical doctor. They're ultimately a doctor. They trained in medicine and then they specialised in psychiatry. So they specialised in diagnostic mental health issues, and they are primarily concerned with diagnosis and treatment through medication from more of a medical model. That's not to say that they all adopt the medical model only, and a lot of psychiatrists are trained in lots of other therapies as well, but ultimately the job of a psychiatrist is that they are a doctor, and usually you might get referred to one if your GP thinks that you're experiencing an issue that's slightly more complex, that needs a bit more investigating or a bit more support. So that's psychiatry. Psychology is the study of the human mind. So actually, it doesn't always have to even include mental health. There are so many different psychologists. You've got the clinical psychologists and the counselling psychologists who do work within the mental health sphere. And they are very much involved in formulating assessments. They do research. They will have PhDs. They're very, very thorough in their work, and they're ultimately researchers, really. And they create treatment plans, and they'll work, very often they're working in hospitals alongside a whole multidisciplinary team of doctors and psychiatrists to formulate treatment plans for people. And they're delivering usually more of the evidence-based therapies. So yeah, that's clinical and counselling psychologists, or you can encounter them privately as well. Then you have psychotherapists. And psychotherapists are the people who are ultimately trained to deliver the therapy. They're the people that, if you're a client, they're the people you're going to see, who are going to give you and deliver you the therapy. And there's loads of different styles and approaches to that therapy, how it's delivered, the way that they talk to you, and what you can expect to happen in the room. So they're broadly categorized into different factions. So if I'm just very, very broad with it, you have the psychoanalytic psychotherapies, then you have the more humanistic psychotherapies, Then you have the more cognitive and behavioral psychotherapies. And then there are some others like the transpersonal therapies. There are others, but those are the broad ones that I'll start with. So psychoanalytic therapies, you've got things like psychoanalysis, which is kind of the very traditional, that sort of the stereotypical one that people see on screen, the kind of Woody Allen style psychotherapy, lying on a couch. Psychoanalysis, the pure psychoanalysis, you'd be in therapy several times a week for that. Then you've got the psychoanalytic and psychodynamic therapies, which draw on that model coming from Freud and Klein, and there's loads of psychoanalysis, Jungian analysis. They all grew out of one another, but the psychodynamic therapies, which can draw on those models, that would be once a week. So that would be your 50 minutes once a week in a room, and typically it's quite focused on your childhood development, or it at least comes from the idea that what happened in your childhood development has a strong influence on whatever's going on in your life now. And the therapist will usually be a bit quieter and not say so much, and you'll lead. With the humanistic therapies, that tends to be more clearly a 1 day a week situation, and the therapist tends to engage you slightly more in dialogue. Again, I'm being very broad here. I know different therapists adopt different approaches in how they do it, but just broadly, a humanistic therapist tends to include themselves a bit more in the session, and it's more reflective and dialogic, so there's more of a conversation happening, and it really comes from the point of view that you're ultimately an expert in your life, and you're responsible for yourself, but it understands that you belong to an environment that informs your experiences, and the two things are kind of interconnected, and so it pays attention to your current environment as much as anything else. It's very crude. I know I'm being very crude with my explanations, but and then you've got your cognitive behavioral ones, which I mentioned before, which are more goal oriented. Maybe you have maybe 6, 8, 12 sessions. You kind of establish with your therapist what the issue is and what the aim is, and there's a lot of practical things that go on. So it could include exposure therapy if you're experiencing phobias or something like OCD, and usually you'll set tasks and homework, and the idea is that your feelings and your behaviors and your thoughts are heavily intertwined and interlinked, and if you impact one of those things, it will have an automatic impact on the other. And typically with something like CBT, cognitive behavioral therapy, the idea is that it's far more difficult to tackle behavior head on and feelings head on than it is to tackle thoughts head on. So typically your thoughts it's not that they're changed, but they're maybe challenged or looked at, which in theory helps make you do something different or think something differently, which will then change the way you feel about it. And it's really quite an investigative process of, well, now that you're thinking that, how do you feel now? And noticing that you have the power to change how you feel depending on what you do and think. So I'm not a CBT therapist, so I'm a Gestalt therapist, so I might have explained that quite crudely as well, but it's just to give an overview of the different types. And then I mentioned transpersonal, which is a bit more spiritually based. So it's the idea that as well as having a mind and a body, you have a soul, and if you're quite a spiritual person, that may really speak to you, that there's a kind of wider purpose for you in the world, and through the therapy you look at your wider, bigger purpose and what that means for you. I hope I haven't gone on and on there. That's a really long
explanation. I think it will be very helpful to people. But listening to you, it strikes me that when it comes to stress, the type of therapy will depend on like the immediacy of the stress versus whether this is something that's repeating itself from a past trauma or chronic kind of experience. So really it's very individual
Yeah,
in terms of what somebody might need.
it's so individual, yeah. And I think that's the thing, is that the more informed you are and the more empowered you are about what's actually out there for you and what's possible, the easier it is for you to think, oh, actually I could do with something like that or this. And sometimes it can surprise you as well. The thing you think you need turns out to be completely different. But knowing what options there are is so important, I think. And if anyone is out there really struggling and not sure where to go, I just really hope that's helped to kind of just give a bit of a map and a picture for you. Because yeah, my heart goes out to people really a lot. Yeah.
Thank you so much, Katie. It was a pleasure to speak to you.
Pleasure to
Thanks
speak
for sharing
to
all
you.
your insights.
Thank you for having me on.
See you soon.
Thank you.